Health, infectious diseases. Well, it's Thursday, last Thursday of August, I guess. Got about 6 months down, maybe another year to go. Good news is 6 months down. So, I'm going to have some short summary of some things going on, the big elephants in the room, so to speak, and then I'm going to turn it over to Dr. Kaylee Brown from Brenner Children's Hospital and Wake Forest School of Medicine, Pediatrics. And we're going to focus on kids today and with questions. But before doing that, so what are the elephants in the room? Well, one big elephant's Chapel Hill. I think we talked about it last week about how students at Chapel Hill got involved in a multi-cluster outbreak of COVID in the city of Chapel Hill, resulting in the closure, basically, of the undergraduate campus and the sending home of students who are in the undergraduate residence halls. And that takes time, so it's still ongoing. But their classes are all online now. So as you might expect, though, some students who are doing their online classes from their apartments and their off-campus living in Chapel Hill because you get a lease for a semester, and so you stay. So not all the campuses have left Chapel Hill. So for those of you who follow case counts, you can go to the North Carolina COVID dashboard, pull up Orange County under cases, and then you can see the number of cases that are occurring in the town of Chapel Hill because of their outbreak. There's been over 800 now affiliated with it, and I'm sure there'll be over 1,000 here in the not too distant future. So the students that are going home should self-quarantine and self-monitor for 14 days while you're doing your online classes, because a good number of the on-campus students, in particular dorms, and you can look up on their websites those dorms that are affected, might very well have been exposed. If you're going to get tested, you should wait at least 5 to 10 days after leaving campus before getting tested to see if you're positive, because it takes a while. So I guess for most people that's probably 5 days has passed by now, so you can do that. If you actually look at the North Carolina COVID dashboard for the entire state, you'll see an uptick of cases in the last week, and a lot of these are due to Chapel Hill. So if you kind of factor those cases out, and it's not just Chapel Hill, but some of the other colleges, mostly on the eastern side, East Carolina, NC State, have had problems as well. And so if you look at those at the North Carolina dashboard, you'll see that that those have affected our numbers for the state. If you take those out, we are still in a steady decline. So the mask wearing, social distancing is working, but a problem with campuses a bit. One thing to keep in mind when you're looking at universities and schools that have cases, the transmission's not really occurring in the classroom. The classrooms are going pretty well because you can mitigate that. And if your students and faculty wear masks and you personally distance in the classroom and you cohort and do hand hygiene, you can have a pretty safe school environment, both in the university as well as under K through 12 schools. It's what happens outside of the school environment and for the universities, the campus life, where the transmission's happening. Here in our area, actually, the universities are back on, including Wake Forest. So far, so good here in the Triads higher education schools, and so that's good news. So the second big elephant in the room is, and it's all over the media, is the CDC changed its suggestions for testing for asymptomatic persons. Sort of. And actually, the media thinks that that when you watch the media, it's like the CDC says no longer test asymptomatic persons. But if you go to the CDC website and actually read what they're saying, is not that at all. In fact, their suggestions are kind of a lot like what we've been doing in public health. So what do they say for asymptomatic people in testing? One is that if you are at high risk of exposure because of your activities, or you've been in a situation where COVID's been circulating and you're a vulnerable individual, then you should get tested even if asymptomatic, but you'll have to do it periodically and to talk to your physician about when. It also says that you may be asked by public health entities if you're involved in a cluster of cases. Let's say you're in a fraternity at Chapel Hill. You may be asked to get tested even though you're asymptomatic so we can define the cluster. We will be doing surveillance testing in asymptomatic people in a population-based way, which means you may be asked by public health and say, hey, your neighborhood is up for testing, come on by. It'll be at the church or at the community center. Come on by, get a test. It'll be free. Public health is doing it. And that helps us understand where COVID is in a community, and that is a good reason to get tested. Or if you're in a zip code, let's say, that seems to be getting hit harder with cases, you may be asked to get tested. So it really actually hasn't changed much. The one thing that we in public health aren't quite as hot on now is testing just for the sake of testing. And so if you look in the media, this is, these long lines of people lining up just to get a COVID test. And there really isn't that helpful, because if you look at a big cross-section of people in a community and you test them asymptomatically, when they're asymptomatic, you get about 0.2 to 0.5% of a positive rate. And that's just really, it's not real effective for contact tracing or putting people in isolation. There's just not enough of them. And the second thing is a lot of people who get a test when they're asymptomatic because they were just, want to feel reassured. If you get a negative test, you really shouldn't feel reassured, because it just means you're negative now. It doesn't mean you'll be negative tonight, negative tomorrow, negative next week. And so sometimes it creates a bit of a false sense of security, and so people let down their guard. And may have wow, I'm negative, let's have a big barbecue in my backyard. I don't have to worry about giving it to anyone, but there could be somebody at the barbecue that gives it to you. If you're going to do that, you're going to have to get tested fairly periodically. The big controversy comes in about testing of people who've been contacts of other persons. And so let's say that I was a contact with somebody who had known COVID 2 days ago. I got a phone call. Say it was my brother. Calls me up. Hey, you remember when we got together last weekend? Hey, I just tested positive, so tag, you're it. You were exposed because I was in the infectious period. And then I'll say, okay, hey, should I run out and get a test now? No. Because it takes 4 to 5 days of incubation for enough virus to get going, if it's going to, for the test to be positive. So you need to wait. How long should you wait? Roughly 4 to 5 days. And then you might say, well, I'll just wait until then and I'll test so I can just go about my business, right? No, you're a contact, you're in quarantine. So you're going to be in quarantine anyway. Let's say you go out then on day 5, you get a negative test. Hey, my test is negative. I can get out of quarantine, right? No, you're still in quarantine, because 25% of people won't develop COVID until later in the 14-day period. You'll probably have to wait to day 10 or so to get your test, your second test. You get your second test. If it comes back negative, can I get out of quarantine? Yeah, well, you waited the 3 days to get your test result back. Guess what? It's already day 14. You're going to get out of quarantine anyway. So those negative tests really don't change things. You're going to be in quarantine regardless if you're a contact of a known case. Now, there are some exceptions for essential workers, critical workers. We find ways to have them continue to work rather than being in solid quarantine. But for most people, you'll be in quarantine for 14 days if you're a contact, even if you have a negative test. It's very, very important to understand that. Well, then you might say, well, what if the test is positive? Then public health can do some contact tracing. Well, most people go into quarantine in the first 3 days after their contact. During that period, very few of them are infectious. And so the contact tracing is really not effective. So that's kind of why they made that recommendation. It's hard to understand, and unless you do a lot of this and see a lot of patients and actually are involved in the public health aspects, it's a little hard to understand. But the bottom line is if you're a contact of a known case and you want to get tested, you still can. No one's going to stop you. It's fine. But wait until day 5 and talk to your physician or public health about that. Before just running out and doing it. So you can do it the right way. And you need to follow the quarantine suggestions to you for 14 days anyway. And then it turns out at the end of all of this, North Carolina said, well, we're just going to keep doing what we've been doing anyway, despite the CDC's changes. And so nothing's really all that different. So I think a lot of people are getting all excited about this. But what the CDC wants us to do is test smarter rather than just blanket large groups of people who may not need one. So that's what that's all about. With that, let's go ahead and talk about kids and COVID. And this has been a hot topic as we open our schools and as kids get back to some of their normal activities. Let me just lead off with saying, that kids have been doing some of this stuff for the last few months. And day camps were going on through the summer. There were some overnight camps that opened up. For the most part, all good in these. A few overnight camp outbreaks and day camp outbreaks were very few and far between. Daycare centers have been open since the beginning, and most of them have done very well. So something's working, and so let's talk about that. So this week we have a guest, Kaylee Brown. Dr. Brown is a pediatrician with Brenner Children's Hospital and with Wake Forest School of Medicine. And she's going to talk to you about some specific things with kids, and then she'll answer some of the questions that you've sent in or other questions that you might have. Dr. Brown. Grab my mask.
Good morning. Thank you for having me this morning. I'm Callie Brown. I'm a faculty member at the Wake Forest School of Medicine in the Department of Pediatrics, and I'm a general pediatrician with Wake Forest Baptist Health and Brenner Children's, and I practice at the Downtown Health Plaza. Since the onset of the pandemic, we know that many kids have missed their well child visits, causing delays in the vaccines that they need to get, causing delays in receiving the appropriate screenings and referrals, and causing delays in anticipatory guidance that kids need and parents need to ensure the children's optimal growth, development, and health. So we want all children to be seen in person for their well visits by their pediatric provider and to receive all of their immunizations on time. Pediatricians are taking many precautions to make sure that their offices are safe. They're separating well and sick visits. Providers, staff, and families are wearing masks at all times. They're doing extra cleanings of exam rooms and equipment and other things to make sure that you and your child stay safe when you go into the office. Also, when children are sick, we want to make sure that you don't wait longer than usual to go see your provider. We've been seeing some kids come in who are sicker than usual, and we think that's because parents are waiting too long to bring them in. So if you would normally take your sick child to your pediatrician, we want you to give your pediatrician a call. Virtual visits are an option. Many of the practices are offering virtual, either telephone or video visits for their patients. And that's an option for many concerns that you may have. And so we want you to call your pediatrician's office and talk to your provider about what visit type is best depending on your concerns. So now we're going to go into some questions that you guys sent to the Facebook account. So Jennifer asks, what precautions can parents take with newborns? So I'm not really advising that parents with newborns do much different now than we typically advise. So we usually advise families with newborns to avoid large gatherings, crowds of people, the grocery store, going to church, all those sorts of things that you're trying to minimize now as well. We encourage frequent hand washing or using hand sanitizer. And then we also want to make sure that anybody living in the household or caring for the newborn, so adults and kids, are getting their flu vaccine and getting their pertussis or Tdap vaccine, because that's going to help protect the newborn as well. And then, of course, making sure that all adults and any kids 2 and older are wearing their masks when they're around other people. And that's going to help to minimize the spread and protect baby. Anne asks, my child has an egg allergy and her pediatrician won't give her the flu shot. Are there any alternatives? So that's a great question. The CDC recommends that all people with an egg allergy receive the flu vaccine. Those who have a history of a severe allergic reaction to eggs should receive the flu vaccine at their provider's office under the supervision of their provider. Wake will be offering flu shots at all of their practices very soon. They'll be doing some drive-by flu clinics and many family flu clinics as well, where the whole family can come and get the flu vaccine at the same time. So call your primary care provider or check out our website, wakehealth.edu, because we want all family members to get the flu vaccine this year. Almost all kids 6 months of age and older can get the flu vaccine, and we want you to get it this September. Renee asks, how could COVID affect children whose parents won't give them the flu shot? Well, we do know that it's possible to get influenza and COVID-19 at the same time. And there's some data that if you have them at the same time, you're going to have a more severe illness. And that's consistent with what we know about influenza and other viruses as well. So that makes sense. Fortunately, it's the same preventative precautions for both. Lots of hand washing, wearing a mask, staying 6 feet away from others, avoiding large gatherings. And then we encourage everybody to get their flu shot to reduce their risk of flu this year. Tammy asks, child care centers are open, but many schools are not. Can you explain the differences between the two? So child care centers tend to serve younger kids, typically 5 and under. They tend to be privately run, and parents make a choice to send their child to that daycare. Whereas schools are responsible for making policy decisions for large populations of children of really diverse ages. The American Academy of Pediatrics recommends in-person learning for all children when a community has the virus spread under control. So we can do our part by wearing our masks, washing our hands, and waiting 6 feet apart to reduce the numbers in our community to help our kids get back to school. Heather asks, what are your thoughts on preschoolers not wearing masks in a classroom? So the American Academy of Pediatrics recommends that any kid 2 and over should wear a mask. And we know from other countries and daycares and preschools in this country that kids can do it. Preschool age kids can wear masks all day, and they do it very well. Parents can help by modeling good behavior, wearing our masks when we go out in public. Setting very clear expectations. This isn't a negotiation. This is the way it is. To go to school, you have to wear a mask. And for our kids, we found it helpful to make masks with different colors. We have Star Wars and Wake Forest and lots of different fun masks that they want to wear, and practice for increasing amount of time. So don't expect them to never wear a mask and then wear it for 8 hours, but kind of practice at home before they need to and gradually increase the amount of time that they're wearing it. Debbie asks, can a group of children share toys while playing outside? This is a hard one. I think if possible, you want to avoid it for younger kids. Kids tend to touch objects and then touch their face, and then touch objects and then touch their face. And so you can have a lot of transmission that way. So I think if it's possible, then that's something you want to try and minimize. For older kids, try and pick activities that don't involve touching. So, maybe a game of soccer where they're kicking the ball around with friends. And then frequent hand washing, as always. So washing your hands and hand sanitizing. This is a great question from Robin. How can parents balance the safety requirements with the social and emotional health needs of children, being constantly told not to touch or breathe near others? Children are naturally geared toward hugging and playing with other kids. So this is a challenge, I think, for all kids and families, including my own. And it's true for adults, too. It's hard for us, and grandparents in our family are struggling with this. So I think when talking to kids, you want to try and stick to the facts. You want to be honest and truthful about what's going on without stoking fear. It's important to recognize that emotional health is important, and you want to think about how can we keep our children interacting with other people in a way that's safe and healthy. So for our family, we've found that scheduling Zoom time with friends has been good. FaceTime reading with grandparents has become a fun activity. And riding bikes with friends is a way that they can spend time with their friends but maintain some physical distance. So I think just figuring out ways that work for you and your child to maintain those social connections and interactions in a way that's still safe and healthy. Lauren asks, should we and our little kids mask and keep our distance when we're around extended family members such as grandparents, aunts, uncles, and cousins, and should they wear masks? So yes and yes, I think is the answer to that question. Ideally, when you're getting together with folks who are not part of your household, you want to aim for activities that are outside, ideally, and trying to stay 6 feet apart. If that's not possible, then I think wearing masks is the right strategy. Holly asks a popular question. What's your opinion on trick-or-treating? Should I prepare my kids now that it's not a good idea this year? Well, as you hear from Dr. Ohl every week, things are changing very rapidly, right? So for me to make a prediction about the end of October, I think would be pretty foolish. But I'm not making any promises to my kids. So I think if they're not able to go trick-or-treating, we'll just think of some other creative ways to make the night fun at home. So whether that's watching a semi-scary movie or a candy hunt at home, I think there are other things that we can do to make it special and fun if we're not able to go trick-or-treating. But I think we'll just have to wait until we see a little closer to the time what the recommendations are going to be. Debbie asks, what are your thoughts on dental visits for children and adults? So dental offices use very high precautions with PPE or personal protective equipment. And so I would encourage you, if you're concerned, to call your dentist and see what they're doing to help minimize risk. While the risk of transmission isn't zero, we do know it's very, very, very low. And we also know that dental health is extremely important for kids. Regular dental visits are key to maintaining healthy teeth, and so for our family, we decided that the benefits far outweighed the risks. I went to the dentist last month and had a great experience, and my kids have appointments to go next month. So I would definitely recommend maintaining those dental visits and ensuring your kids are brushing their teeth twice a day and flossing. Laura asks, we're hearing of COVID cases in schools, but overall, how are kids really doing? So there is some new evidence coming out that the novel coronavirus lives in the mouth and nose and the upper respiratory tract at high rates in children. Yet it still seems that kids are transmitting the virus less than we typically expect for other viruses. For example, kids rarely seem to be passing on the virus to other adults in their own household. It usually comes from the adults to the children, not the other way around. We also know that children living in low-income families are being disproportionately affected by this pandemic. That's true both for increased rates of COVID infections, but also worsening educational disparities not being in school. And so that's one of the reasons that the American Academy of Pediatrics recommends resuming in-person school as soon as is safe, because children get many benefits at school in addition to academics. Children learn social and emotional skills, and they receive exercise and mental health support. They receive access to healthy meals, and school is a safe place for children to be while their parents are working. So we encourage everybody to take the necessary precautions so that we can lower the rates in our community and get our kids back to school. Overall, however, I want you to remember that kids are resilient, far more resilient than we ever give them credit for. So continue to be positive and role model good behavior for our kids. And when you're talking to your kids about wearing a mask or why they can't have playdates with our friends, I think it's important to tell them we're doing these things to show love for other people and to help our community. And you can use this as an opportunity to teach positive lessons through a difficult time. Thank you. Dr. Old?
So, yeah, a lot about schools, and I think one thing to keep in mind that there are a lot of benefits from in-person school. So when we can work out a way to do it safely, it is definitely worth doing. The other thing is that you'll hear a lot of reports in the media. Wow, there was a case here, there was a case there. First day of school and there was a case. You got to keep in mind that does not mean there's transmission in the school. It means that people who have gotten exposed to COVID somewhere else and then have then got sick and may have been at school the day before. This is going to happen. And it happens with all sorts of communicable diseases, like whooping cough and chicken pox and so on and so forth, and we know how to deal with those in those settings. I also wanted to say I've been thinking a lot, Dr. Brown, about Halloween, because I like a good Halloween, and I there may be a way to have some Halloween and modify how we do it a little bit. So the trick-or-treating part might have to be different. So you know what? Let's do this. There's a lot of people out there who got a lot of great ideas. So send us your ideas on what you think would make a good Halloween for the COVID time, because I suspect COVID will still be here in October. Send us your ideas. We'll compile them, looking at the guys over here on the desk, and then I'll talk about your ideas next week, and let's see if we can come up with a way to have some Halloween in the triad for our kids. Our kids have gone through a long haul with this, and the more we can do to give them to give them a little bit of highlight and fun, I think is a way. There's probably a way to do it safely. So I have a question for Dr. Brown. What do you think about play dates? So some people are saying, let's get some pods together, and maybe a bubble over there and a bubble over here, and we'll let their kids play with our kids. How about that? Play dates and then sleepovers. What do you think about that?
Yeah, I think it's a great question. My kids ask me that a lot. So, ultimately I think the fewer people that you are exposed to, the better. And so I think, for our family has chosen not to do indoor play dates, not to do sleepovers, to really try and stick to, outside play dates, meeting friends maybe at the pool, outdoor spaces where, you feel like your kids can have some physical distance. I know with parents going back to work and kids going to school, it's really hard. And so some families are kind of, pairing up where, you go to one house one day and one house the other. And I think sometimes you just have to make choices in order to get by and to do it. And so I'm certainly not going to say that that's not something you should do. I think every family has to kind of look at what is the risk for your household. Do you have somebody that's high risk or not? And then what sorts of things do you need in terms of childcare and the emotional and social health of your child? So I'm not sure that there's one answer that applies to every family, but I think anything that you can do to minimize your exposure to people who don't live in your household is better.
Any questions for you? All right, well, thank you very much. So we have the Halloween challenge. So I'll look forward to that for next week. And next week we'll also update on what's been going on and over the last week see how our universities are doing and come up with more pointers as time goes on. So with that, we'll go ahead and wrap it up. And thank you.